Dehydration in children. Causes, signs, prevention, and treatment. Dehydration in children is a serious issue that parents and caregivers should always be aware of. It happens when the body loses more fluids than it takes in, which can lead to problems with normal body functions. Children are more vulnerable to dehydration than adults because their bodies contain a higher percentage of water and they lose fluids more quickly through sweating, urination, and even breathing. When a child becomes dehydrated, their body struggles to work properly, which can cause tiredness, dizziness, headaches, and more serious health problems if not treated quickly. One of the most common causes of dehydration in children is diarrhea. When a child has diarrhea, they lose a large amount of fluids rapidly. If they also experience vomiting, the fluid loss becomes even worse, making dehydration occur faster. Even if a child is drinking fluids, vomiting may prevent their body from keeping them down. This is why dehydration often accompanies stomach viruses, food poisoning, and other digestive issues. Fever is another major cause of dehydration. When a child has a high fever, their body sweats more in an attempt to cool down, leading to fluid loss. Many children do not feel thirsty when they have a fever, which makes it easy for them to become dehydrated without realizing it. If a child refuses to drink fluids when they have a fever, the risk of dehydration increases significantly. Not drinking enough water is another common cause of dehydration. Many children get so busy playing, watching TV, or doing activities that they forget to drink water. This is particularly dangerous in hot weather when their bodies lose more fluids through sweating. Children who play sports or engage in physical activities are at an even higher risk. If they don't replace the fluids they lose, they can quickly become dehydrated. Understanding the signs of dehydration is crucial for early treatment. Mild dehydration symptoms include dry lips, a dry mouth, and dark yellow urine. The child may also urinate less frequently than usual. If the dehydration becomes worse, symptoms can include dizziness, extreme tiredness, sunken eyes, and a lack of tears when crying. Severe dehydration can cause confusion, rapid heartbeat, and even unconsciousness. Babies and younger children show different symptoms, such as refusing to drink milk, being overly fussy, or having a soft spot on their head that appears sunken. If dehydration is severe, medical attention is needed immediately. If a child is dehydrated, the first thing to do is replace the lost fluids. Plain water is a good start, but sometimes it is not enough, especially if the child has lost important minerals and electrolytes. Oral rehydration solutions, ORS, are highly recommended because they help restore the body's balance of fluids and salts. ORS packets can be found at pharmacies and mixed with clean water to create a rehydration drink. If you do not have ORS at home, you can make a simple homemade solution by mixing half a teaspoon of salt and 6 teaspoons of sugar in 1 liter of clean water. This mixture helps the body absorb fluids more effectively and recover faster. Encouraging a child to drink fluids can be difficult, especially if they feel sick. Offering small sips frequently can be more effective than trying to get them to drink a full glass at once. Some children prefer different forms of fluids, such as ice chips, coconut water, diluted fruit juices, or clear soups. Coconut water is especially beneficial because it naturally contains electrolytes that help with hydration. If a baby is still breastfeeding, continuing to nurse can provide hydration and essential nutrients at the same time. In addition to fluids, certain foods can help with hydration. Water-rich fruits and vegetables such as watermelon, oranges, cucumbers, and strawberries can help increase a child's fluid intake. Yogurt is also a great option because it contains water and beneficial probiotics that support digestion. On the other hand, drinks that contain caffeine, soda, or high amounts of sugar should be avoided because they can make dehydration worse. These drinks can cause the body to lose more water instead of replenishing it. Ensuring that a child gets enough rest is also important. Dehydration can make children feel weak, so they need to stay in a cool, comfortable place while their bodies recover. If they have diarrhea or vomiting, it is important to check on them regularly and make sure they are not losing too many fluids too quickly. Keeping the room temperature comfortable and dressing them in light clothing can also help prevent further fluid loss. Preventing dehydration is easier than treating it. The best way to prevent dehydration is to ensure that children drink enough fluids throughout the day. Parents and caregivers should encourage children to drink water even when they are not thirsty. Sending children to school with a water bottle and reminding them to drink regularly can help maintain hydration. On hot days, increasing their fluid intake is especially important as they lose more water through sweat. If a child is sick with diarrhea, vomiting, or fever, it is important to start giving them fluids before dehydration sets in. Offering small amounts of ORS or other rehydration drinks frequently can help keep their fluid levels balanced. If they refuse to drink plain water, offering flavored water, herbal teas, or fruit popsicles can make it more appealing. A healthy diet also plays a role in preventing dehydration. Foods that are naturally rich in water, such as soups, fresh fruits, and vegetables, can help keep a child's fluid levels stable. Avoiding too many salty or processed foods is also important because these can make a child feel thirstier and lead to dehydration if they do not drink enough water. Sugary drinks should also be limited, as they do not provide the necessary hydration and can cause additional health problems. Monitoring a child's urine can provide clues about their hydration status. If their urine is light yellow or clear, they are well hydrated. However, if their urine is dark yellow, it is a sign that they need to drink more fluids. If a child has not urinated in 6 to 8 hours, they are likely dehydrated and need to drink more water immediately. Encouraging children to drink enough water can sometimes be a challenge. Making hydration fun can help. Adding fruit slices like lemon, orange, or cucumber to water can make it more flavorful. Using colorful cups, fun straws, or setting up a daily water drinking goal can motivate children to drink more. Making hydration a fun habit can ensure that children get enough fluids every day. While mild dehydration can be treated at home, knowing when to seek medical help is important. If a child is extremely weak, unable to drink, has sunken eyes, dry skin, or is very irritable and confused, they should be taken to a doctor immediately. Severe dehydration can be dangerous and may require treatment such as IV fluids to restore the body's balance. Delaying treatment can lead to serious complications, so it is always better to seek medical help if you are unsure. Dehydration is a common problem in children, but with the right care and attention, it can be prevented and treated effectively. Ensuring that children drink enough fluids, eat water-rich foods, and avoid excessive heat exposure can help keep them safe. Taking early action when a child is sick can also prevent dehydration from becoming severe. With proper hydration, children can stay healthy, active, and full of energy. By keeping an eye on their hydration levels, offering a variety of drinks, and watching for early signs of dehydration, parents can ensure their children stay hydrated and happy. Making hydration a priority every day can prevent small problems from turning into big ones. A little extra effort goes a long way in keeping children healthy and strong. This way, dehydration can be avoided, and children can enjoy their daily activities without any health concerns related to fluid loss. To further emphasize the importance of hydration, caregivers should also lead by example. When children see their parents drinking water regularly, they are more likely to follow the habit themselves. Schools and daycare centers should also promote hydration by ensuring that clean drinking water is available and encouraging children to take water breaks. In community settings, spreading awareness about the dangers of dehydration can help ensure that all children stay safe and well hydrated, no matter where they are.